Hi, my name is Kate and welcome to our channel. Today we're going to have a conversation with Mohrbacher. She is a world-known board-certified lactation consultant from Chicago. She is an author, a trainer. She co-authored a lot of books about breastfeeding and just a huge supporter of breastfeeding. She has a wonderful website where you can find a lot of free videos on the positioning, and in this conversation we're making a deep dive into how to make breastfeeding a joyful experience for both the child and the mother, which is supposed to be. This conversation will be useful for new mothers, especially if you're struggling with breastfeeding. Nancy is giving a lot of insights on that. So hope you will enjoy it, and if so, please don't forget to like it and subscribe to our channel. Basics insights around breastfeeding that you would recommend for any mother who just had a child. So we're imagining the first time mom, and what would be their several top critical points you would mention to this woman about breastfeeding?
Well, I think probably the most important thing to know is that the early weeks of breastfeeding are a very intense time. That when a newborn arrives, they have a very tiny stomach, and so they need to feed very, very often. And it can feel a little overwhelming sometimes because the baby oftentimes will spend, even hours, nursing, like moving from side to side and wanting to nurse. But that's actually a good thing because it's the very frequent removal of milk from the breast that establishes a very healthy milk production. So the more the milk is removed, the more milk is made. But I think many times new mothers are not expecting the baby to want to feed so much. They think, for example, that maybe the baby will want to nurse every 2 to 3 hours or something like that, because often it's said that babies nurse, roughly 8 to 12 times in a 24-hour day. But typically it's not spaced out evenly. They tend to cluster their feeds together. And so instead of there being regular intervals in between nursing sessions, like every let's say 2 hours or whatever, the baby wants to feed very, very often. So in many cases, it's in the evening. I don't know why that is, but it seems to be the case worldwide. Like right around the time a mother's starting to prepare dinner, that's when the baby wants to sit down and feed very often. And the early evening is another time where it's very, very common. It would be, the baby seems hungry again after half an hour or an hour instead of, being satisfied for longer periods. So that's what cluster feeding is. And it's actually a great way for the baby to adjust the milk production if that's needed. That's how babies boost milk production. So it's not a sign of low milk production, but it's baby's way of ensuring that there is healthy milk production.
And how long does it last, like this cluster feeding, till what age?
Well, I usually tell new parents to just expect that for the first 4 to 6 weeks, they're going to be doing nothing but breastfeeding because that's what it feels like. It's not necessarily true, but that's what it feels like. Oftentimes, these frequency days where babies are nursing like crazy. You see them especially like at around 3 weeks, at around 6 weeks, and at around 12 weeks. And we don't really know why. People have their guesses, but it's a time that many, many babies go through this very intensive nursing period. I think that that's really helpful to know, to make plans ahead of time, to make sure you have like meals, people bring you meals, so you don't have to cook and have extra help from the family. I think, often in countries outside my own, people are a little smarter about that, and they're ready to take care of new mothers a little better than we do here in the United States. But another thing I think that's really important to know is that ideally, breastfeeding is not supposed to hurt. Many mothers think that pain during nursing is normal. And I would say probably a little bit of a feeling of tenderness in the first minute or two, in the first couple of weeks, is common, and that would be considered within the normal range of experiences. But if it's really hurting, that is usually a sign that the baby is not latched on deeply enough. In other words, the nipple needs to go far back in the baby's mouth. In one of my books, I call this place the comfort zone, that when the nipple gets back there, then there's no friction or pressure. And one easy way to do that, I've spent the last 15 years or so describing some early breastfeeding positions that I think really make early nursing easier. And that is if you lean back and the baby is on top of you, baby is tummy down on your body, and is resting on your body, the baby can actually latch on by themselves, and that will help them to get on a little bit deeper. Oftentimes, new mothers are sitting up straight and they're trying to push the baby on, and that's makes it a lot more complicated. So I do have a website called naturalbreastfeeding.com, and there's a free video on the homepage that you can watch that describes these early positions. And what we now have actually research that shows that using these positions in the early weeks during the learning period, when mother and baby are both learning how to breastfeed, can actually cut the number of breastfeeding problems in half. So we have half the incidence of nipple pain and breast pain and all that sort of thing. So those are a couple of pointers, I think, that are good to know about early breastfeeding. A third thing I would want to say is that you need to understand that as the baby gets a little older and gets more practice with breastfeeding, it will get easier. So this very intense time in the beginning, I would say the first 4 to 6 weeks are extremely intense. But then if you just continue exclusive breastfeeding during that time, you'll come out of it with a very healthy milk production, and the baby will start to get a little bit more regular in terms of their feeding times. It's not going to be quite so intense. So knowing that it's like an investment in the beginning, that you're investing all this time and work in breastfeeding your baby, but then it really pays off, as your baby gets a little bit older and his stomach gets bigger and, he's able to feed a little faster, and, everything just gets a little simpler after that.
You also mentioned already about the pain, that the pain shouldn't be the norm of the breastfeeding. What could be the other reasons for nipple pain apart from the baby not latching correctly, let's say?
Not getting a deep latch, having the baby latched on shallowly is the number one most common reason for problems. But there can be other reasons too. For example, if a baby has what's called a tongue tie, where they can't move their tongue normally, that can sometimes cause pain during nursing, and that would be something that the doctor could check for. Really, if the vast, I spent 10 years in private practice, making home visits and seeing lots and lots of mothers, and I would say in almost every case, even if there might be another cause, getting a deeper latch usually makes nursing more comfortable.
Sometimes there are babies who look, let's say, reluctant to breastfeed. They might need some encouragement. Why it might be the case, and how somebody can try to encourage the baby to breastfeed more.
Many babies are looking for certain physical cues to breastfeed. Babies are born with what we call inborn feeding behaviors. What it is that cues a baby to feed is full frontal contact with the parents. So as I mentioned before, leaning back and putting the baby tummy down on top of your body. It's that full frontal contact, the face and the chest and the legs and the feet against the body that trigger that. So that usually, and if you can do it skin to skin with the baby just in a diaper, that's even better, because these inborn feeding behaviors are very hardy and long lasting. And many babies with feeding problems, if you let them be the ones who are doing the latching, they will do a much better job and they'll be less reluctant. Oftentimes if babies have been shoved to the breast repeatedly, that can be very off-putting to them, and they can become reluctant to nurse.